Good morning. How's everybody? How are you today? You guys comment in here. Let me know how you're doing. I always want to know how you're doing. So I say that every time. I know it sounds like a broken record, but I do want to know how you're doing. It helps us to know what's happening in your lives. You are important to us. Your lives are important to the people on the planet, and we want to know how you're doing. So, how did a patient come in this morning? I know it's early. It's only 9:45, but um, our nurse practitioner Christina did a follow-up on a patient this morning who did some neuropathy treatment with us. And I know a lot of you know our office because of a video that I did about gabapentin and our feelings about gabapentin. So and most people are prescribed gabapentin, most people, because of some neurological issue like neuropathy. So I had a patient come in this morning who did a follow-up on his neuropathy treatment. So we did some treatments with him using microcurrent therapy, something called Hockamed. We did some pulsed electromagnetic field therapy. We did a few other modalities in our office, and we have him doing some therapies at home. And we also did stem cell injections in his legs and feet. So this gentleman was really in a bad way. He was not getting along well at all in life. He was on the verge of really being losing his what's the word I'm looking for? Losing his independence, right? And so we did some treatment with him. Now he came back in for a follow-up this morning, and this is what he told us. Okay, he said his neurologist, who, keep in mind, put him on gabapentin and told him there was nothing that could be done for him. His neurologist, he went back and did an evaluation on his feet. His neurologist did an evaluation on his feet and legs and said he's doing so well, like he's improved so vastly, that he demanded practically that he come in and get his records. The doctor demanded the patient come into our office, get his records, and bring them to him so he could find out what we were doing. All right, to help him.
We told him that maybe he should just tell his doctor that he went somewhere where they practice healthcare
instead of sick care,
not sick care.
Right. So now, of course, we want more people to deliver the things that we do. So we are going to share all that information with them, and hopefully more people can benefit from the types of treatment and therapies that we do. But it's interesting when all you think about is practicing sick care and you lose the idea. First, you have to lose the idea that something can be done. If you lose the idea that something can be done and something can be improved, then all you're going to do is maintain and manage illness and sickness. Or whatever the problem is, that's all that's going to happen if that's all you do. So we were significantly able to help this individual, and we found it very, very interesting that this doctor wanted to know what our protocols were for those things. So if you're suffering, I want you to know there are things you can do. Okay, so PEMF therapy, Hockamed, you can use red light therapy, LED light, infrared light therapy can help. Vibration, different things can help those nerves. I see somebody posting about fibromyalgia. So much can be done for fibromyalgia. It does take work. And the reason I wanted Karen to come on is, Karen, this is my wife. Some of you have seen before. Isn't she beautiful? So the best mom anywhere, by the way. Best wife. Very understanding. She puts up with all my crap. So but she's a certified holistic health coach. And one of the things that we see in the office is there comes a point in people's lives where two things happen. Number one is they start degenerating very quickly. And number two, they lose hope. Okay. And the loss of hope happens usually much later. Okay. That happens much later, but people start degenerating rapidly. And we see this in the office. I've been practicing for 22 years. When do you think that happens? What decade of someone's life do you think that they actually start heading downhill? And what happens, I'm saying they start heading downhill, but they actually don't decide to do something about it until much later. So there's a point where they should be handling it and they're not. They decide not to. And then they get to a point where they go, now it's time to start handling it. Something happened way before. So we were talking about that this morning, right?
We were, and I met with a couple 2 days ago, and beautiful, lovely couple in their 70s. She had 2 knee replacements that went bad. She's now in a full brace and in a wheelchair, and he is her caretaker and has a very bad back and neck. And I met with this couple, and they came to us because now they want to do something about it. And unfortunately, they are at a point where we can certainly help, but in terms of reversing what's happening in their body, they're past. Yeah. The degeneration is so advanced that we're not going to be able to undo the degeneration. We can help give comfort and help ease that discomfort, but we're not undoing anything.
There's some, for sure, there's some improvement that they can have,
without
for sure.
Question,
100%,
without question.
Improvement, but it is, there comes a point where it is like, how bad, so therefore how much improvement can be had. And when I say that, most of the people that we see are not as degenerated as these two people. We see people that are in horrible shape, bone on bone arthritis, horrible shape, and we're truly able to make significant difference. And we would be able for them too. The point of the video is, when should they have started taking care of it?
So I was thinking about this for us, for our age, and we're both in our
70s.
Yes.
So,
no.
We look great, right?
Late-ish 40s. And I thought that time is now. Now is the time where if something is going on physically, we sort of have the idea of like, oh, well, I'll heal. I've always just healed. It's always just gotten better. If I just let it alone, it'll be fine. And really through your 20s, even into your 30s, that's pretty true. Like, things kind of can get better. Your healing capacity is still pretty great. But in our age group is the time where we can't afford to say, I will handle it later. I've got work, I've got things with the kids, I don't have time. I'll take an Advil and just make it through the rest of the day. I'm sure if I get a good night's sleep, I'll feel fine. Those are all the things that we say and probably would say through our 40s, even probably into our 50s, until things are degenerating faster and faster. And it's sort of a drop off. It gradually worsens and then worsens faster. And I just realized, it just became really firm for me that the time to do things is now. Now is the time to do
It actually
things.
Doesn't matter how old you are.
Right. If you're 33 or 43 or 53, the time is now. There's no more, I'm just going to wait. I'll just put it off. I'll handle it later. I'm sure it will be fine. The time is really now to do something about it. And we see so many patients who wish that they had addressed the problem even 5 years earlier, 10 years earlier, 15 years earlier.
And the other part to that is, so many people are getting sicker younger because of chemicals in our environment, because of medical intervention. That had a patient the other day, he had a Cipro reaction. Like he'd had, and this is very, very common, by the way, is you take an antibiotic, the fluoroquinolones, and he had a reaction that really destroyed a lot of his nerves. He's in really bad shape. But those medical interventions can cause problems early on in life, and we're seeing that. And I'm not an anti-vaccine person. Actually, the ideas of vaccines, I think, are valid. It's the chemicals and stuff that are put into them that can be really horrible. But for a lot of people, the point being is, there's so much in our environment now that impacts our health in a negative way earlier on in life.
Right.
It's not just a degenerative process. It's a diet process based on crappy foods and chemicals in our food and in our diet, in chemicals that are put into the food supply, not just things that we put on our food.
Right. Well, not only that, but we're seated. We've got this device now. Our posture is poor. We are, just even the advent of vehicles alone increased the speed at which people can degenerate because of traumas to the spine, etc.
Sure.
Lots of things like that.
So the time for you to take care of yourself,
it's now,
right
now.
Okay, it is right now. It's not going to get better as you go along. We all kind of cross our fingers, right? We all cross our fingers and say, maybe it'll go away.
Right.
And it is important to have hope. It truly is important. It's vital for you to have hope. It's vital for you to have confidence that things will go away. But when you start having something that's creeping up or it's recurring, it goes away and comes back, that is something you take care of as soon as possible, not something you put off.
Right.
Because these people that we met with the other day, they would have had they could have vastly different outcomes if they'd have handled things probably even just 5 or 10 years ago.
Right. 5 years ago would have been vastly different.
And they're in their 70s. Now we have people that are 80s. I have a 93-year-old patient who did stem cell on her hip, and she thinks that we are magicians. Not me, my nurse practitioners. I don't do the injections, but she thinks we're magicians, and she thought she was past the point of healing. And absolutely that's not the case. If you're above ground and taking in oxygen, right? If you're above ground and taking in oxygen, there's hope. But it's obviously better the earlier you catch things.
Right.
So I wanted to share that success from the neuropathy patient and just kind of put a little dig in there for those doctors to say there's nothing you could do about it. Doctors, if you're a nurse, if you're a doctor, if you're something, if you're out there practicing and you're practicing sick care, leave the dark side, okay? There is sick care that's needed. We need acute care in this country and all over the world. The United States, fortunately, knock on wood, we have the best acute care on the planet. We just have horrible, horrible health care. We don't do anything really in this country to help people actually be healthy and well. And
generally speaking,
people are waking up a little bit, but it takes health care to get people healthy. Sick care is only going to produce more sickness.
Right.
Now's the time to take care of yourself. That guy who came in this morning, what a win.
Oh,
we
yeah.
love hearing those
So great.
things.
So great.
Had a patient yesterday, by the way, started on a functional medicine program with us just about 2-3 weeks. You were
a few weeks
ago. She's unbelievably happy with her care, doing great. We love to share the wins of what we're able to do in our office. We hope we can help you all. If you need us, you know where to find us right here on Facebook. You can message us.
Right.
We will definitely respond to as many comments as we can. Appreciate you. Share this, especially if you know somebody having neuropathy or fibromyalgia or any of these things that are degenerative in nature. They might be able to benefit from some of this information, or we can help them in some way. So we appreciate you sharing. Okay, somebody's giving us a call here. It appears we have to get back to work. Appreciate you guys watching.
Gotta go.
Love you. Bye.
Bye. Wow.